Hi, this video will walk you through how to prepare for your upcoming dental implant surgery so everything goes smoothly and safely. First off, plan ahead. Meal prep. After surgery, you won't feel like cooking, so planning ahead makes a big difference. Before your appointment, stock your kitchen with soft foods like smoothies and protein shakes, yogurt, soup and broth, mashed potatoes, applesauce, eggs, oatmeal, and pudding. Avoid anything crunchy, spicy, or hard. Have enough food ready for at least 3 to 5 days. Second, your driver is required. You must bring a responsible adult to drive you to and from the surgery. If you're receiving IV sedation, oral sedation, or general sedation, or even just strong pain medication, you're not going to be allowed to drive. Uber doesn't work, leave that alone. Your driver must check you in, stay in the office or nearby to take you home, and then stay with you for at least the rest of the day to monitor you. Also, bring all of your medications with you. Please bring all your medications with you to your surgery appointment, including your prescriptions, any over-the-counter meds, or supplements that you bought ahead of time. This allows us to double check that you are taking everything correctly and safely. Fourth, follow fasting instructions, or NPO. If you're having sedation, you must follow NPO instructions. That means no food or drink for at least 8 hours before surgery. That includes water, coffee, gum, mints. This is so critical for your safety during sedation, and you can't take it lightly. If we realize that you've had something before your sedation, we'll actually have to cancel it and charge you a cancellation fee, and that's not fun for anyone. Fifth, no alcohol, drugs, or extra medications. In the 7 days before surgery, do not drink alcohol, use recreational drugs, or take any medications that has not been prescribed by your dentist. Do not take extra pain meds, muscle relaxers, or sedatives. These substances can dangerously interact with anesthesia and pain medications. Next, be on time. Please arrive on time or early for your surgery. Sedation appointments are carefully scheduled, and arriving late may mean that your procedure must be rescheduled for safety. What to expect when you go home. After surgery, you're going to be sleepy, you're going to feel groggy, you're going to have some numbness, you're going to have some swelling, and you're probably going to have some bleeding as well. This is perfectly normal. Your escort should get you home safely, help you get settled, and make sure you take your medications on schedule. Now, you'll want to watch for any excessive bleeding or swelling. We'll have some more on that later. Next, set up your recovery space. Before surgery, prepare a comfortable place to rest with extra pillows for head elevation, ice packs, gauze, your medications of course, and soft foods. This makes healing much easier. Preparing properly is one of the best things that you can do to ensure that a smooth surgery and a fast recovery is for you. If you have any questions following your appointment, please contact our office. We're here to help.